So the cardiac cycle explains a lot of what's going on in the heart, a lot of the physiology, and can tie even to pathology. The cardiac cycle is just the events that occur from the beginning of one heartbeat to the beginning of the next, and it includes things like systole, which is contraction, ejection, and diastole, relaxation, and filling. It's generated by the spontaneous generation of an action potential at the sinus node, and the duration of the cardiac cycle is the reciprocal of the heart rate, which means the faster the heart rate, the shorter in duration of the cardiac cycle, which means a shorter filling time, a shorter diastole. If we look at the phases of the cardiac cycle and we focus first on the central component, diastole, we'll see that during this time our ventricles are filling with blood. And we can see this represented here by this increase in this ventricular volume curve. It's going to start with the opening of our AV valves. That's when it's going to start because then filling can happen. And that allows for passive inflow of blood from the atria to the ventricles. There are three subphases. It's not really important that you know all of the subphases. Essentially, it's rapid inflow, diastole, which is kind of the whole phase. And then the only unique one is atrial systole, which you can see here denoted by this small little bump. This is where the aorta, or the not the aorta, the atria contracts to give a little extra juice, a little extra blood, about 20% of filling to the ventricles. In our systolic portion of our heart cardiac cycle, this is where we're ejecting blood during systole. It starts with the closure of the AV valves. We can see that closure here. And then this is going to allow for the muscle to contract against a closed door system, kind of like screwing a water bottle on or a cap onto a plastic water bottle and twisting it. There's going to be more and more pressure. And eventually, if that pressure of the water bottle, the ventricle, overrides the pressure of the cap, then you'll see ejection of blood or ejection of fluid from the water bottle. There are three subphases: isovolumic contraction, ejection, and isovolemic relaxation. Isovolemic contraction is just contraction of the ventricular wall, but no fluid is leaving, so no emptying. That's really where we're squeezing that bottle with a plastic cap on to try to get as much pressure as possible from here to here. Then ejection is getting rid of the stuff, and then isovolumetric relaxation is just no more ejection, just the muscle tissue is relaxing. We can relate this to our heart valves. Our atrioventricular valves include our tricuspid and mitral valves, and our papillary muscles attach via the chordae tendineae, and they close to start systole, and they open to start rapid inflow of diastole. Our semilunar valves include our pulmonary or pulmonic and aortic valves, and they open to start ejection and they close to start diastole. They're both opening and closing passively when the pressure gradient pushes blood backward or forward against them. Speaking of pressure, we can follow the pressure curves on this chart. So we can look at the aortic pressure curve first. Pressure during diastole is going to decrease because the aortic valve is closed. At the end of isovolumetric contraction, right here, the aortic valve will open, and that's because the pressure of the ventricle has reached the pressure of the aorta. During ejection, the aortic pressure will raise equal to that of the ventricle, about 120 millimeters of mercury, or whatever blood pressure systolic is. And they'll decrease back to baseline here after closure of the aortic valve, which is around like 80 millimeters of mercury. A similar action will occur from the right ventricle to the pulmonary artery, but the pressure system is going to be much, much smaller. The atrial pressure curve is this bottom dotted line. We'll see an initial wave occurs. This is our A wave during atrial systole due to atrial contraction. There's then a secondary wave that happens during isovolemic contraction. This isn't as important. It's just essentially the blood back bulging on the AV valves from just ventricular pressure. And then the V wave happens during isovolemic relaxation because the atria fill without the AV valve being opened quite yet, which allows for rapid filling to take place. We can relate pressure and volume curves together by writing out a curve that looks something like this. You're not going to have these images, but you might need to know like what would cause a right shift or a left shift or an up shift or a down shift. So our first phase is following from A to B. This is where we're filling. We'll see that we start at end systolic volume at A, and we end at end diastolic volume at B, and we're really not increasing pressure a lot. It's only a mild pressure increase. Then from B to C, we see the period of isovolemic contraction, And this is where the pressure increases because contraction's taking place, but the valve is not opening. There's no volume change. Then we have our big kind of show, our ejection, which is going to be from C to D. This is where our volume will decrease back down to our end systolic volume, and that's through the process of injecting blood into the aorta. The pressure will rise to increase due to the increased ventricular contraction. And then lastly, we have to reset the system from D to A. So we are essentially seeing the aortic valve close, ventricular pressure returns to a diastolic pressure level, and there's no more volume changes. We'll see that our EKG, our electrocardiogram, can also be measured or tracked on this cardiac cycle here. We have several different waves. The P wave is due to the depolarization for the atria, which is followed by atrial systole. The QRS complex here is due to depolarization through the ventricles, which is followed by a ventricular contraction. And then our T wave is due to repolarization of the ventricles, which happens slightly before isovolemic relaxation. We can also see our heart sounds, S1 and S2, representing closure of the valves. S1 is closure of AV, S2 is closure of pulmonic, and you might even learn how to identify a third, which would be Kentucky, or a fourth, Tennessee. We're going to pause here. When we come back, we'll look at regulation of the heart.